I am Dr. Harish Gowda, consultant laparoscopic and general surgeon and surgical gastroenterologist. I am the founder and director of HIMAS. I am going to explain about the breast diseases. Breast diseases most common in both in young patients, in elderly patients. So it can be categorized into the benign diseases and the malignant diseases. In the benign diseases, fibroadenoma, fibrocystic diseases and cyclical mastalgia. These are the most common ailments in younger patients. If the patient has a lump in the breast, so we have to think about in terms of malignancy in elderly patients. So that's why I'm going to discuss about every symptoms and signs of benign breast disease now. In cyclical mastalgia, the young female will have the breast pain during menstrual cycles. So they will have a intolerable pain in both the breast and mood swings. So for this, the usually treatment is very symptomatic. We treat with some painkillers and multivitamin and art foment. We advise the art fomentation for the patients. If the young patients have a swelling in the breast which is mobile, which is moving in the breast, then we can think about this is a simple fibroadenoma. So we advise the patient to have a self breast examination before coming to the clinician. Then they have to come to a clinician for an examination of any swelling in the breast. So for the treatment of fibroadenoma, it is very simple. Usually we will do a simple excision called excisional biopsy. We will send for the biopsy. So another one condition called fibrocystic disease. Usually the patient will have a multiple small nodular swelling in both the breasts. Even for that also the treatment is simple and it is a conservative management and a proper counseling, and we advise some painkillers on and off and art fomentation. The main bothering issue is the malignancy. So we advise any female with a lump in the breast, they have to do a self-examination every monthly, and if they found out any lump in the breast, they have to come to a clinician where we do a proper clinical examination. If the lump is fixed to the breast, if it is increasing in size, if there is any skin changes over the lump, that is, we think in a suspicious of malignancy. That time we do very simple investigations like sonomammogram, FNAC of the swelling. So that gives a clear-cut diagnosis whether we can manage conservatively or with a simple surgery. So most of the time it will be a very simple surgery of excision of the lump in the breast, that is done under local anesthesia, and it is a painless procedure. If the lump in the breast is very large and present since long duration, and if there is any skin changes, we do consider a malignancy is one of the options where we investigate thoroughly. If there is a confirmation of a malignancy, we are going to treat with a multimodal approach. There are so many varieties of treatment for a cancer of the breast if the patient comes in very early stage. That's why we advise each and every female to get breast examined every monthly and get an attention of a clinician every yearly with a sonomammogram. So if we diagnose the cancer in early stage, the treatment it is curable. Any breast cancer can be cured in an early stage.